Ladies and gentlemen, dear BiasLife franchise owners, my name is Dr. Peter Verdegam, and I am the Chief Science Officer of Unicity International. Welcome to this episode of the BiasLife Franchise Product Trading Call. Today, however, we will focus on a product that is also very important in the management of risk reduction for cardiovascular disease. This product is called Cellular Essentials. Cellular Essentials is a great add-on to BiasLife, and that is because the two products are highly complementary. The number one killer in the United States and in most other countries around the world is cardiovascular disease. This disease is caused by a number of factors that are greatly related to our lifestyle. Some examples are our lack of nutrition, our lack of physical exercise, excessive alcohol consumption, of course smoking, and, like so many of us, being overweight. All these risk factors are very common in our society and can be dealt with by making the right lifestyle choices. Unfortunately, we all know that it's getting increasingly difficult to make those right lifestyle choices. But the number one risk factor remains unbalanced cholesterol levels. By unbalanced, I mean a high level of LDL, or bad cholesterol, and a low level of HDL, which is also known as good cholesterol. Cholesterol has two sources in our body. It can either come from our food, particularly unhealthy animal fat-rich food, and the other source is our own liver production, which counts for about 80% of the total cholesterol levels in our body. The most recent statistics of the American Heart Association indicate that about 105,200,000 adults in the United States have a cholesterol level that is too high. The mean level of LDL, the bad cholesterol, for American adults aged 20 and older is 123 milligrams per deciliter. And levels in between 130 and 159 are considered borderline high. And if you have levels of 160 to 189, we call them high, and above 190, the American Heart Association considers those levels very high. When you walk around with a high level of cholesterol for a long period of time, the vasculature, or circulation, starts to clog up. And this process is called atherosclerosis. It's not unlike a drain system that has to transport dirty sewer water for a long period of time. This will also clog up over time. Atherosclerosis is characterized by the formation of a plaque consistent of cholesterol, fatty acids, and calcium deposits. Now, the plaque becomes larger and larger over time and may eventually block the artery from efficient blood transport. When this happens, the blood flow is slowed down, and this may lead in reduced transport of nutrients, vitamins, minerals, and, of course, oxygen through the body. Usually, however, the process of atherosclerosis has no immediate symptoms and can only be detected by scans in the hospital. Now, the biggest problem of the plaque is that it can become unstable and rupture at a certain point. When this happens, the blood forms a thrombus, and the complete blood flow is blocked. And if this happens, it deprives the heart or brain from oxygen, and a heart attack or a stroke is the result. And interestingly, for 50% of the men and a stunning 64% of the women in our society, this is the first symptom that they experience of cardiovascular disease. Unfortunately, usually it's then too late. Now, BiasLife is our nutritional breakthrough that controls the risk of developing unbalanced cholesterol levels. Through 4 mechanisms, it effectively lowers LDL, or bad cholesterol, and increases HDL cholesterol at the same time. This is of great benefit to prevent the formation of dangerous atherosclerotic plaques, or delay the growing of an existing plaque. Using BiasLife twice or even more per day will effectively reduce the risk for cardiovascular disease. The increase in HDL that is caused by BiasLife will also reduce the plaque size in the arteries. That has been shown by a number of studies. And that's because HDL is known to function as kind of a crowbar to remove cholesterol from the plaque and transport it back to the liver so that it can be broken down. This process, however, is very slow. The plaque is formed in a period of about 20 to 40 years, so it will also take quite a long time to remove it again by simply raising the HDL. Now, what if you want to reduce the plaque size faster over time and return to a healthy circulation system once you have already formed a plaque? Well, for these people, Cellular Essentials is the answer. And this product was developed several years ago based on the Nobel Prize-winning research of Professor Linus Pauling. Now, this research focused on the need of maintaining a healthy arterial wall to prevent the formation of a plaque. Professor Pauling postulated that the plaque formation was a reaction to a reduction in the arterial strength. He thought that plaque was some kind of a bodily response that put a layer of protection on the inside of the artery that would repair a weak spot. Now, he knew that certain vitamin deficiencies would cause these weak spots. The most important one of the vitamins is vitamin C. This vitamin is responsible for the synthesis of collagen, an important structural component of arterial walls. He also postulated that humans who were in constant chronic vitamin C deficiency would develop these weak spots and hence would develop a plaque. He strengthened his argument by observing that dogs, for example, never develop a plaque, or never develop heart disease for that matter, simply because these animals could synthesize vitamin C themselves and would never be in a chronic deficient state. In fact, heart disease is a disease that is almost only present in humans. Cellular Essentials, based on this research and these postulates, therefore contains a large dose of vitamin C to combat this chronic deficiency and take away the need to form a plaque in the arteries. The product contains two forms of vitamin C, a water-soluble and a fat-soluble one. This unique feature of Cellular Essentials makes that the vitamin C can actually serve in both the fat and the water layers, and this greatly increases the effectiveness by a number of magnitudes. Cellular Essentials further contains a complete vitamin, mineral, amino acid, and antioxidant profile to further enhance the protection for cardiovascular disease. The B vitamins in Cellular Essentials are very important to support the energy metabolism that our heart needs to be able to assure daily cardiac output. B vitamins serve as cofactors in energy synthesis pathways in our bodies. They're also very important in reducing the levels of homocysteine in our body. This parameter, homocysteine, is another important risk factor for cardiovascular disease, next to cholesterol. And some scientists even think that homocysteine is actually even more important than cholesterol, and that high levels of homocysteine form the trigger of the atherosclerotic process. The other vitamins in Cellular Essentials are vitamins A, C, D, and E, and we also have minerals, calcium, phosphorus, magnesium, zinc, selenium, copper, manganese, chromium, molybdenum, and potassium. Now, these vitamins and minerals all serve as further antioxidant enhancing components. The vitamins themselves serve as direct antioxidants, while the minerals are cofactors in antioxidant enzymes. The free radical damage is very dangerous in relation to the atherosclerotic process because oxidation of LDL particles speeds up the plaque formations considerably. The Cellular Essentials further contains 5 different amino acids. We have proline, lysine, arginine, carnitine, and cysteine. Amino acids, of course, are the building blocks for proteins and therefore very important in providing structural components for vascular health. Arginine has another important secondary role. It produces nitric oxide in the body. Now, this small molecule, which is actually known as Molecule of the Year a couple of years ago, serves as the major vasodilator in our body. And by doing so, it ensures that our vascular system stays relaxed during the day and prevents it from being constricted. And this results in a lower blood pressure. Another important amino acid is carnitine. Now, this amino acid serves as a key in opening the door to the mitochondria for free fatty acids. Mitochondria are also known as the energy plants of cells and are the home of the respiratory chain. Now, this biochemical pathway is key in energy production for every cell, but in particular for the heart muscle cell, since these cells need the majority of energy in our body. Free fatty acids serves as the fuel for this process, but they need to get into the mitochondria to do their job. Without adequate carnitine, the free fatty acids are not able to enter the cell. Therefore, carnitine in Cellular Essentials ensures active energy production to the heart muscle cells. And the final ingredients in Cellular Essentials are CoQ10 and pycnogenol. CoQ10 is a small fat-soluble molecule that is a key player in the respiratory chain to create energy for the heart muscle. Without this molecule, no energy could be produced. It's important for all of us, but in particularly for people that are using statin medication to lower their cholesterol. It's known that statins cause a lower CoQ10 level in the body, and this deprives the heart muscle of adequate energy to pump the blood around in the body. Normally, our heart compensates for this deficiency by enlarging itself so that it is able to pump more blood through the body. But it can also lead to heart failure, another important risk of taking statin medication. Many doctors actually don't know that statin users should always supplement with CoQ10 to prevent this potentially dangerous deficiency. Pycnogenol is a proprietary antioxidant from French maritime pine bark that has excellent protectionary properties, and particularly for the microvasculature, the small vesicles in all our tissue. Now, let's discuss some of the clinical proof that Unicity has obtained that this product, Cellular Essentials, is really working in reducing the plaque size. The first trial I will discuss was published in 1996. And the aim of this study was to determine the effect of Cellular Essentials on the natural progression of coronary artery disease. This study was designed as a prospective intervention before and after trial over a 12-month period, and it included 55 patients in the age ranging from 44 to 67, and they all had various stages of coronary heart disease. Changes in the progression of coronary artery calcification before and during the use of Cellular Essentials were determined by ultra-fast computed tomography. The progression of coronary artery calcification, that is plaque size, decreased on average 15% over the course of 1 year of Cellular Essentials supplementation. And in a subgroup of patients with early stages of this coronary artery disease, a statistically significant decrease occurred, and no further progression of coronary plaque formation was observed. In individual cases in this study, reversal and complete disappearance of previously existing coronary plaques were documented. And this is the first clinical study documenting the effectiveness of Cellular Essentials in halting early forms of coronary artery disease within 1 year. These results were absolutely fascinating for the first time a nutritional product had been proven to reduce the plaque size and delay further progression of atherosclerosis. The second study that we performed at Unicity with Cellular Essentials was performed by Dr. Bill Curley from Las Vegas. Cellular Essentials was studied in patients with atherosclerosis in the carotid arteries. And this artery, the carotid artery, supplies blood directly from the heart to the brain. And plaque buildup in these arteries is particularly dangerous since it may lead to a stroke once the plaques are large enough. Dr. Bill Curley used Cellular Essentials in his carotid patient group for 1 year and compared them to a similar group of people with carotid atherosclerosis, but that were not using the product Cellular Essentials. And the results were very clear. Cellular Essentials reduced the plaque size by 18.2% on average, whereas the non-users saw an increase of 5.5%. So there is a difference of over 23% between the Cellular Essentials group and the control group. And this means that people using Cellular Essentials had a clear reduction in the risk for stroke, and it actually may reverse the need for operative removal of the plaque. This study was so interestingly that it had been accepted by the 6th Annual Conference on Atherosclerosis, Thrombosis, and Vascular Biology that was organized by the American Heart Association. And the American Heart Association has given wide interest to these studies because, there's not a good way of safely removing plaque buildup in the arteries in the body. And the American Heart Association concluded that Cellular Essentials is a very effective approach to reach the goal of removing atherosclerotic plaques and removing the need for a surgical way in accomplishing this task. Now, of course, these studies are needed to convince the medical professionals, but for me as a scientist, it's very rewarding to know many individuals that have successfully removed their plaque from their arteries using Cellular Essentials. It's not uncommon, really, that they show me their scans showing arteries that are as clean as the ones from a baby, even when they're 50 or 60, simply by taking Cellular Essentials for a consistent period of time. So BioSlife and Cellular Essentials is really an ideal combination of product. BioSlife is going to provide effective cholesterol optimization, preventing you to form a plaque. But for people that have already an existing plaque, like many of us have, Cellular Essentials will remove those plaques, make them smaller, and prevent them from growing bigger. This is the best way to reduce your risk for cardiovascular disease, taking BioSlife and Cellular Essentials at the same time. Ladies and gentlemen, this was this week's episode of the BioSlife Product Training Call. Thank you for calling in, and I hope that you will do the same thing next week. Bye-bye.